Good morning, everybody. This is Dr. Sonia McGowan, and we are here today for our monthly webinar to talk about Autism is Medical. So I'm going to give people just a few more seconds to get in and get settled, and then we'll get started. So if you have any questions at all, do not hesitate to put them in the Q&A box. You'll see that menu on your screen. And we'll also have plenty of time at the end. I'll sort of wait around and make time for folks to put in their questions. So, all right. So here we go. Welcome, everybody. I'm glad you're here. Again, I'm Dr. Sonia McGowan. I am the owner of Covenant Pediatric Wellness Center in Jefferson City, Missouri. Here we specialize in complex kids. So by that, we mean kids with autism, kids with PANS and PANDAS, really any child who's struggling in any way at all. They are our jam, and we're really, really good at helping kids with those issues. So this is my family. So on your left, you'll see me with my husband, Shannon. He and I are newly empty nesters, which is very strange. He is a CPA and he's looking at retirement pretty soon. So he's pretty excited about that. Then you'll see our daughter, Libby. These are kind of oldish pictures of her. I probably should update those, but she lives in Kansas City now. She's done with school. She is a music director for School of Rock. And in fact, at that top picture, you see her holding a bass guitar. She's a musician, and that's me behind her. We were at an open mic night in Kansas City a few years ago, so I got to play drums with my kids. So that was amazing. And then we have Rowan, who is 19. He's in college now. He goes to Millikan University. And I always include the picture of him as a little guy because when he was little, he really struggled. We had a lot of issues around, sensory processing, language delays, auditory processing delays. He didn't sleep. He was covered in eczema. He had terrible diarrhea most of the time. And he was nonverbal at age 4. And by the time he reached kindergarten, with the approach that I now take in my clinic, he was indistinguishable from his peers. He did eventually develop diagnoses of dyslexia and auditory processing disorder, but he's essentially overcome 99% of that. He's in college. He still has a 504 plan that we brought over from high school, but he needs no accommodations, no support, and he's doing great. He is a theater costuming major, and yeah, he's rocking it. So he is really the reason why this clinic looks the way it does, because I've been there as a mom, and I remember how lonely it was and how isolating it was and frustrating to have a little child who, you tried to get help for them. You took them everywhere and everyone just told you, it was in your head or you were a bad parent. So there is hope for all kids. All right. So at our clinic, we offer several things. So like I mentioned in the beginning, we serve complex kids. So we do neurodevelopmental exams. We work with a biomedical approach, which is more of what I'm going to talk about today. We also do craniosacral therapy, chiropractic. All of it is really focused on getting to the bottom of symptoms. So we look for the why behind behavior, because here we believe and we know that there are no bad kids and there is no purposeless behavior. And so there's a reason why kids aren't sleeping. There's a reason why kids are irritable. There's a reason why, they withhold their stool or they are constipated. And so we work really hard to figure out the why and address that, and so that kids get better. We also have Covenant Pediatrics. So we have a pediatrician on staff who is a DO. And so she provides general pediatric care for any kid who needs it. And she's also developing great skills and depth of experience with kids with complex needs. So we're sort of a beacon for families who have challenging kids. And so she's really loving getting some of these complex cases that we work on together. We also do a lot of work around oral restrictions. So we have comprehensive evaluations and interventions for things like tongue tie, lip tie, cheek ties. We offer craniosacral therapy, myofunctional therapy, feeding therapy, etc. And then while we don't do the releases ourselves, we're not qualified to do that. We do have referral partners, dentists who are greatly skilled and experienced in oral tie releases, who we refer to. We also specialize in prenatal and pediatric chiropractic. We have a lactation consultant, and then we do just general family wellness as well. So we have chiropractors on staff who work with people of all ages, even adults. We have acupuncture. In fact, next week we are unveiling our new massage therapy program. We have hyperbaric oxygen therapy. We do functional nutrition for typical adults. And we also do the ion cleanse foot bath detox system as well. All right. So when we talk about complex kids, what do I mean by that? So it started out, honestly, being kids with autism. So I was an autism specialist. It's what I did my whole career, even before I became a doctor. So that's always one of the first things I think about is kids with autism. But over the years, what we're seeing is really an evolution in complex kids. And so I sort of changed my language from just autism to complex kids because I want to encompass sort of the whole spectrum. And so when we talk about complex kids, I also might mean kids with PANS and PANDAS. So we do have an integrative PANDAS clinic here. Dr. Strong, our pediatrician, and myself are experienced and skilled in identifying and managing cases of PANS and PANDAS, any sort of behavior, language, socialization issue, even without a diagnosis. So maybe it's dyslexia, maybe it's auditory processing disorder, maybe it's just in the blue circle, what I call square peg round hole kids. So we know that they're struggling, something's up, they're struggling with behavior, with language, communication, they're not doing well in the classroom, etc. Maybe they're not sleeping at night, they're constipated, right? And so these are the kind of square peg round hole kids that we're sort of good at figuring out. All right, so sensory processing issues are a big deal for a lot of kids. ADD, ADHD. We work with kids with retained primitive reflexes, and like I mentioned before, kids, and even some adults who have oral restrictions. So we call that TOTS, tethered oral tissues. All right, so again, like I mentioned earlier, our motto is the why matters. So we're always working to dig deeper in whatever way we need to figure out the why behind kids' behavior. We address that. It's not a Band-Aid. Kids get better because we fix the root cause of the problem. So autism is medical. Now, I should really sort of say complex kids are medical, right? So any of the things in that wheel that I just talked about really have a chemical, a biochemistry, metabolic basis. And for kids with autism and other complex needs, there are consistent findings that I hear over and over again in histories, and I see over and over again in physical symptoms when I do their exams, in behaviors, in the labs that I run. I have worked with kids with autism, kids and adults with autism, since I was out of college in the early 90s. So I have literally seen everything. And when I learned at what was then called a DAN conference, now considered a MAPS conference, once I figured out and learned that autism is not genetic, that kids with autism are not just bags of behavior, right? There's more to it, and that there can be more than just genetic causes. In fact, in my opinion, there's rarely genetic causes, sometimes, but primarily the issues are environmental, they're metabolic. And when we can sort of dive in and figure all that out and we address that, then kids improve for sure. And so in a history, these are some of the things I'm looking for. So common features that parents report is in infancy. So we have some milestone issues. So a lot of times kids will meet milestones early. Sometimes they meet them late. The early meeting of milestones is not a badge of honor. Okay. So when my son was born, he was a very big baby. He was almost 10 pounds. And I remember they called him Tank in the nursery, and all the nurses were like, "Look at him, look at Rowan," right? Because he was trying to hold his head up and look outside the little bassinet. He was moving his arms trying to get out of the swaddle. And he I remember writing in his baby book, "Oh my gosh, Rowan just rolled over at 3 days old. No one will believe me when I tell them this." And I thought it was great. I'm like, "I've got a baby genius on my hands." Well, I did have a baby genius, but that was not that was not a good thing. What it told me, or what I didn't know then and I know now, is that kids who do things like that are too early, it means the tone in their system is too high. Um, and so meeting those milestones early are definitely a red flag. Um, Parents who have complex kids will tell me that as infants, they often had nursing and sleep challenges. They were kids with colic. Many times they have torticollis or plagiocephaly. Usually they go together. So torticollis is when you've got kind of a rotation and lateral flexion of the head. So a baby is stuck like this. And because of that, then they generally develop a flat spot on the back of their head. And so this is absolutely a red flag. And many, many complex kids tend to come to me with this history. We also see lots of kids with autism and complex needs who had early antibiotic exposure. So maybe mom had antibiotics during delivery, baby had, antibiotics soon after birth for whatever reason. Often it's ear infections, but repeated rounds of antibiotics can be definitely a red flag. In the toddler stage, so parents will tell me, he's very irritable, very angry, just temperament issues. We'll see some energy levels that can be inconsistent. So sometimes kids just go like the Energizer Bunny. They never slow down, right? Even at bedtime, these are kids who will amp up instead of getting sleepy like the rest of us. Sometimes we have kids who run out of gas really easily, really quickly. So if they, have to walk, or they, you go to the park, or they go to Six Flags or whatever, they want to be carried, they want to be put in the stroller because they don't have energy. So again, with the milestone issues, ear infections, tubes in the ears are a big red flag. Often these are kids who have a negative response to vaccines. And often these are kids who will show some sort of regression. Sometimes it's a global regression. They lose lots of skills. Sometimes, they might lose language, or they might lose play skills. But any sign of regression is definitely something I pay attention to. And one of the questions I always ask is, when did you notice that something seemed different with your child? Parents always know. They almost know to the exact date. He was fine until this happened, and then he was like this. Some parents will say, it was sort of a slow regression. All right. Now, other things that parents report, that their child's behavior improves with fever or illness. This is very common. This is a sign of a dysregulated immune system, and definitely needs attention. Any sort of urinary change, so kids who were, dry at night, now they're wetting the bed, or kids who were potty trained during the day and now they're having accidents. Any sort of, frequency, volume, urgency, anything like that is certainly something I pay attention to. And then anything with a sort of overnight acute onset is a red flag for me. I definitely pay attention. And okay, sorry about that. My internet blinked for a second, so hopefully there we go. Everybody's back on. Okay, sorry about that. So my big three when I'm talking to parents is, how do they sleep, how and what do they eat, and how are their poops? These are kind of the big three that are sort of signs or red flags that things are going awry, and that we've got to jump in and pay attention and do something, figure this out. All right, so some physical clues. Let's talk about that. So it's really, really common for kids with complex needs, kids with autism, to have skin issues. Eczema, particularly on the face or on the flexors. So by that I mean the bends of the elbows, the backside, the bends of the knees. Eczema is a big deal. Most parents are told, oh, they'll grow out of it. It's fine. Here's a cream to put on it. They don't grow out of eczema. They grow into other things that generally are worse. And skin is a reflection of the gut. So any sort of eczema, any kind of, rash, hives, anything like that tends to be a reflection of what's happening in the intestine. Keratosis pilaris. So I just saw a little one yesterday who had this pretty significantly on her cheeks, her arms, on her legs as well. Sometimes we call it chicken skin. So it's just those rough bumps. Upper arms and thighs, again, are common. A lot of times we see it on the back. We'll see it on the cheeks as well. These are kids who generally have pretty dry skin. Often they're kind of stinky. Their feet stink. Just their body odor is odd. Often they're pale. They have dark circles under their eyes. We'll also see kids, who get really red cheeks, really red ears. This could be my son as a toddler. He had a severe herpetiform rash on the backs of his knees. Usually this is a gluten issue, not always, but very frequently this is a sign of a gluten sensitivity. Are you kidding? Okay, sorry. No. I thought I was disconnected. So anyway, sorry. So when we got rid of gluten, Rowan's rash on the backs of his knees completely went away. So he was able to go back to gluten, which was great. And he does fine with it now. All right. So hair that is thin, hair that is sparse, it flies away, it won't lay down. Hair, nails, and fingernails, toenails that don't grow as we expect are definite red flags. This is telling me metabolically something is different. Something has been disrupted. We need to test and figure out exactly what's happening. Really common to see very dry lips and to see cracks at the corners of the mouth. This is related to deficiencies nearly every time. And so we've got, again, to dig in and figure out exactly what's going on. The tongue tells us so much. I always look at kids' tongues whenever they'll allow me to do that. So geographic tongues, tongues with scallops around the edges or fissures down the middle, all of this, also fingernails, the white spots, the ridges, the spooning, all of it points to metabolic issues. So sometimes it's deficiencies. Most of the time it is. Sometimes it's mitochondrial issues. The kids are not making energy inside the cell very efficiently. And so sometimes we'll see head shape differences. So earlier I mentioned torticollis and plagiocephaly, so the head stuck, flat spot. We definitely see that, head shape differences. We'll also often see prominent foreheads that don't seem to run in the family. Mom and dad don't have prominent foreheads. So when you see this little gal here, that's almost always a vitamin D deficiency. And a head that's large in relation to the body can be a red flag as well. These are kids with poochy bellies. They're terribly bloated. They generally will have very abnormal bowel sounds. Sometimes kids are real tender when I palpate their abdomens. And in general, they're just not great at digesting. They're not good eaters, and it shows on their bodies. So some behavioral clues. So these are kids who, again, generally aren't great eaters. Some of them are, but as a general rule, it's very common to see these kids are selective eaters. They don't want to sit down and eat a full meal. They just want to graze. They want to just eat a little bit all the time. When we see kids who graze, it almost always is signaling me that they probably have belly pain, that they just don't have the words to express. These are kids who generally have a self-induced limited diet. So that, again, they're very selective and they crave certain things. Most of the time it's carbs. Most of the time it's kind of junky sort of food. And digestive challenges are such a big deal. So these are two different kids. They don't know each other. They're from totally different parts of the country, but they both posture in the very same way. And this is a really common posture that I see. These are kids who are trying to help their bellies feel better, generally because they have poor digestion. Often they're constipated. And so we'll see kids posture like that. We'll also see them, take adults' hands and press against their abdomen. We'll see them lay over couch arms, things like that. And so all of these digestive challenges are super common. Again, with the posturing, bloating, lots of reflux, lots of drooling. Parents will frequently tell me that when they change their diaper, look in the potty, they see undigested food in the stool, belly aches, teeth grinding, constipation. It's really common for kids to be constipated, but then have what we call breakthrough diarrhea. So they're constipated, and then here comes diarrhea around it. And just in general, to have weird poops. It smells funny, it looks funny, right? It's the wrong color, it's the wrong consistency. A lot of times we'll see kids who will smear their own poop. And this is not behavioral, right? It's a sign of deeper digestive issues. These are also kids who don't sleep. This is very common. So they get hyper at bedtime. They can't fall asleep. They wake up in the night and they're laughing and giggling and talking to themselves. They wake super early. They're restless when they sleep. They snore. They sleep with their mouth open. All of these are things that are a big deal. We have to pay attention to them in kids. Sometimes we see kids with low stamina. They need a long recovery time after physical tasks. They want to be carried. They want to ride in the stroller. Sometimes kids will even indicate or communicate to their best ability that they have leg pain. It's very, very common. And so this little guy here, you can see, this is Liz. She's our OT. She was doing some feeding therapy with him. And this little guy, when he eats, he has to lay down. He does not have very good energy making in the cell. He has mitochondrial dysfunction. And so eating takes so much energy. He doesn't have the extra energy to be able to just sit up and eat. He always lays down. So these are kids who, in my experience, are generally forgotten by regular medicine, right? They're ignored. Moms are patted on their head and said, it's fine. They're going to grow out of it. Parents are often told that obvious medical issues are just autism, or they're just pandas, fill in the blank. Oops, sorry about that. And kids are often denied basic medical care because they have autism or another complex diagnosis. So parents will ask, hey, can you run some blood work? Can you do this test or do that test? And most of the time they're denied that. Or, caveat, maybe the pediatrician will acquiesce and do labs for the parent just to make them happy, but they don't know how to analyze them. They're like, oh, look, everything's fine, when it's not necessarily fine. So let's talk about labs. So here's what I see really consistently on labs of complex kids. Major deficiencies. This is the first thing I look at. Generally, I see pretty significant deficiencies in B vitamins, minerals, and antioxidants. By antioxidants, I mean vitamins A, C, D, and E. Glutathione is a big one, alpha lipoic acid, etc. So most kids are deficient across the board. We also see really low levels of omega-3s, so those essential fatty acids. Low cholesterol is very common. In fact, it's so common that if I'm able to do a blood draw, I test this on every child. If you want more information about low cholesterol, go to my website, thewhymatters.net, and scroll down and find the low cholesterol webinar and watch it, because it is a very, very big deal for complex kids and kids with autism. Other lab findings. So I find intestinal dysbiosis. I find intestinal malabsorption. I find mitochondrial dysfunction. So these are kids who don't make energy inside the cell. And what I always tell parents is, you have to be able to make energy, just like gas in a car. If you don't have gas in the car, you can't do higher level things like run the defrost or the radio, okay? And so just like in the body, if you aren't making ATP, the energy currency for the body, you can't expect the body to do higher level things like have good gut health, like absorb food, have a functioning, robust immune system, develop language, sit at school and pay attention, learn to write, learn to speak, right? All of these are very much higher level things. And if you can't do, if your basement is a mess, your attic's going to be a mess too. Okay. Um, Hi, Dana. Hi, Laura. Thanks for the questions. Hang on and I'll get to those. Okay. We also see neurotransmitter dysregulation. So we see neurotransmitters, those chemical messengers like dopamine, serotonin, epinephrine are highly dysregulated. And often that's because of the deficiency issue, right? You've got to have those basic nutrients for those higher level things to work, like hormones, like neurotransmitters. A big, big one for complex kids is fat maldigestion. These are kids who don't digest very well at all to begin with, but they definitely have inefficiencies around digesting fats. So because of that, we often see the low cholesterol, we see low fatty acids, and all of that can lead to things like keratosis and dry skin, all of those things. And sort of the biggest picture of that is you get more energy per calorie from fat than you do anything else. So if you're not digesting fat, you're already behind the 8 ball in terms of mitochondrial function. So what do fingernails, Dana's asking, what do fingernails that are thin and peel mean? So generally, your fingernails are sort of a glimpse into your overall health. When you see the white spots, that generally is a mineral deficiency. When we see thin and peeling, often that can mean an iron deficiency. It can mean malabsorption. It can mean poor digestion of protein. And what multivitamins help, or do we need individual ones? I really base it on the individual kid. Laura's asking about this. Generally, I choose a mitochondrial cocktail. So it has basically all the nutrients that a child would be deficient in, plus it has the nutrients that make ATP. So it helps that Krebs cycle go inside the mitochondria to make the energy currency of the body. And so it again, it depends on the lab. So I generally will pick the thing that has what the child needs. So there are lots of choices, and I try to individualize it. All right. We also see very consistently dehydration. So these are kids who just globally are dehydrated. We really see it when I draw blood. So it's sometimes really hard to get a good stick on these kids because they're just so dry. Low iron, anemia, dysregulated blood glucose is a big one. So these are kids who, they really don't manage their blood sugar very well. It really often ties back to the malabsorption, to the fat maldigestion, right? Because that's part of what keeps your blood glucose stable. So these are kids who, it's not like us. They can't say, oh, I ate lunch late, I'm hangry, right? They're kids who will act out and they'll be irritable, and it shows in their behavior. We see often very dysregulated immune system markers, very common to see low vitamin D. I mean, if I see a normal vitamin D level on a complex kid, it's like, I can't even believe it. And part of the challenge here is that the reference ranges for most of these things are so wide. You have to be, really, really deficient, or, really on the edges for a traditional medical provider to say, oh, you're out of range. So for example, vitamin D, the reference range for normal is 30 to 100. Ideally, in my world of functional nutrition, it needs to be 75. So you can understand why if traditional medical providers don't have in-depth training, they're going to look and say, oh, you're within the reference range, everything's fine, even though that level may not be ideal. All right, so some other consistent lab findings that I see. Lots of pathogens and toxins. Our kids are just absolute sponges for the pathogens and toxins that are in the environment. So we see things like heavy metals, aluminum, mercury, cadmium, you name it. We see a lot of parasites, mycotoxins. So these are mold toxins. Mold toxins can come from food, from the environment. They can come from water damaged buildings. And it's crazy how just our kids just soak these toxins up. Lyme and co-infection, so things like Ehrlichia, rickettsia. There are several co-infections that go along with Lyme. Strep and other bacteria is big. High viral load. So I'm pretty consistently looking at things like Epstein-Barr antibodies. I'm looking at COVID antibodies, looking at cytomegalovirus, HHV6, influenza, etc., because these viral antibodies, as well as the strep antibodies, can really trigger behavior. Environmental chemicals are big. Things like glyphosate, pesticides, herbicides are often really sort of in high levels in kids and can be triggers for their health issues. We see very often impaired detox pathways. These are kids who are just clogged up. They just do not release toxins. But remember, these are also kids who generally, globally, have really poor mitochondrial dysfunction. Really poor mitochondrial function. They don't make cellular energy. It takes a great deal of cellular energy to be able to detoxify. So we've got to fix that first and then look at detox later. Commonly, we see food allergies and food sensitivities that can impact health and behavior. And so when we systematically test for and address these specific issues, guess what? They get better. And so let's talk about a couple of kids. These are just kids who are in my practice. I just sort of plucked them out and wanted to sort of describe to you their case. So this little gal, at the time that we saw her, she was 5. She was typically developing, likely a gifted IQ. She went from just being happy-go-lucky, perfectly fine little gal to an acute onset of fears. So extreme separation anxiety. They have a very close-knit family. Their extended family, everyone lives sort of right together in the same road. She stopped looking at or speaking to her grandparents and her uncle. Now, these are, again, they live close together. They're together all the time. And suddenly she wouldn't speak to these people anymore. She would have attacks where she couldn't calm down. She couldn't sleep alone because she was too scared. She developed a low stamina, lots of motion sickness, complaining of headaches. And so we did some labs with her. She was unable to tolerate a blood draw. She couldn't tolerate a finger stick either. So we did a urine test instead. And this is a test I do very frequently. It's called the metabolomics from Genova Diagnostics. And so this is telling us about her deficiencies. And look, just like you would think, green is good, yellow and red are not. So the only place that she's really okay is molybdenum and zinc. Everything else she's deficient. Now, this is a family. They're not giving her like Lucky Charms and Mountain Dew for breakfast. They're real, like normal people. They eat real meals that they cook at home. And so despite everything, real food, nice, stable home, look at her deficiencies. How can she not be having some challenges, right? And so when this is another page of that same test, and so you can see here, this section is telling us about malabsorption. It's severe. She also has yeast overgrowth in her intestine, so intestinal dysbiosis. This is telling me how well she makes energy in the cell, not well at all. If we jump over here, this is telling us about neurotransmitters. She's definitely dysregulated here. She's not good at detoxifying, okay? So these are, again, these common themes that I see. And so what we found is she definitely had deficiencies. She definitely had mitochondrial dysfunction. She had issues with yeast in her intestine. So we treated all of that with supplements. We also put her on the schedule for chiropractic adjustments, craniosacral therapy. I really wanted to rule out strep and low cholesterol, but because she couldn't tolerate the blood situation, we weren't able to do that. So we started all of this in November, the adjustments and the craniosacral, while we waited for labs to come back. We started her biomed program in December. And by Christmas of that same year, same month, she was talking to her grandparents and her uncle again. She was sleeping. Most of the fears had gone away. She was pretty much back to baseline in just a matter of weeks. And so this little guy, I love him. This is Corwin. He has been coming to me probably since 2018 or 19. And so he was 7 at the time of these photos, started seeing me at age 5. And so his presenting complaints were severe mouth ulcers, and you can see these photos. He had diarrhea, frequent urination, frequent fever. So he would have 105 plus fever for up to 10 days at a time. His anxiety was severe. He missed the majority of his kindergarten year because of his symptoms. And when he came to me, was very small, very thin, pale, dark circles under his eyes. I remember he had this little bear with him, and he was desperately clinging to the bear. I'm a fun doctor. Like, we generally have fun in my clinic, but he was scared to death. And I included this picture because one of his anxiety relievers was with his mom's wedding ring. He would spend time touching it, and that seemed to calm him down. And he's a neurotypical guy. He had any sort of developmental disability at all. And so I did his exam, and here's some of the things that I found. He had delayed eruption of his adult teeth. This is very much a red flag for mitochondrial dysfunction. Of course, the geographic tongue, the very severe mouth ulcers, because they were so severe, it really limited what he was able to eat. At the time of his initial exam, his eardrums were bulging. He had dark circles. His reflexes and pupillary response were very inconsistent. He had the keratosis pilaris, that chicken skin, on his upper arms, and then also some white spots. So his skin was tan, but he had these pale spots on his arms. And so this is the same test. This was an old version because this was, a few years ago. So you can see he had some fairly significant deficiencies. We did a stool test with him also. And so the bacteria in the green section are good ones. We want them to be in high levels, but he had some strep and some other Klebsiella, really bad guys overgrowing in his intestine. Also, his secretory IgA was crazy high. This is a class of antibodies that act as the first line of defense against things like this in the intestine. And so his immune system was on fire. And then we also did a food allergy and sensitivity test. And so anywhere you see red or yellow, these are allergies and sensitivities. So he had just a lot going on. And so we did some blood work with him. The strep was negative. I was really surprised by that. We found lots of issues around intestinal health. So we worked on that with probiotics and gut healing powder. We worked on his mitochondrial issues. We did chiropractic adjustments and craniosacral therapy. And he turned around, and he's doing great in school now. Occasionally he'll have just an intermittent issue that will come up, and we are just able to easily manage it, but he's in school, he's doing fine. And it turned around pretty quickly. This was a kid who was, they were going to St. Louis, they were having scopes, GI scopes. And nothing was helping until we changed his diet. We dug in and we figured out what the root causes of these mouth ulcers and other complaints were. No more fevers, right? The mouth ulcers went away. It was life-changing for him. And, we changed his trajectory, and we did it just with a couple of tests. Are they cheap? Not necessarily, but in the long run, yeah. I mean, look at what we saved that family in the long run. So again, the why matters. It mattered for the first little girl we talked about. It mattered for Corwin, because until we got to the actual root of the problem, nothing was going to change. And, we have lots of tests that can help us figure this out. Most of them are fairly uninvasive. A urine test, a stool test, not hard for kids to do generally. I really do like to get blood when we're able. We're very good at blood draws here, even on kids who are uncooperative, combative sometimes. We're really good at it. And what we know is it's worth it. 5 minutes of a difficult blood draw can give us the data that helps us, really change the trajectory for a kid. So call it what you want, but autism and other issues around complex kids is medical. It's metabolic. So it doesn't matter what we call it. There are consistencies across their biochemistry. And when we address the chemistry and we really understand how it works, we can fix the root cause of the problem. And bottom line is recovery is possible. We see kids all the time who lose their diagnoses. My own son, I consider him my first recovery story. He was on the path to an autism diagnosis, guaranteed. But I really didn't want to go there because I felt like there was more to it. And I mean, proof's in the pudding, he's neurotypical now and thriving. And so if you're concerned about your child, if you're seeing in your kid some of the things that I described in this webinar, you need to talk to somebody who knows what they're doing. It doesn't have to be me. We are taking new patients. Honestly, I don't think I'll ever stop taking new patients because the need is so great. And we take patients from all over the United States. We have, patients overseas, because the way that we approach autism and complex kids is so novel, and it's so incredibly successful. I don't mean to sound like it's bragging. It's not bragging when it's true, is what my husband says. So we are taking new patients. So remember, we have lots of practitioners here. Of course, there's me. We have Dr. Maddie, who is a chiropractor. This is Dr. Hannah Strong, our pediatrician. This is Dr. Kayla Nieper, also one of our chiropractors. So, and she has been with me for a while, and so she has lots of experience sort of in this biomed realm. And so she's the person who does kind of the initial history taking on complex kids. So there we go. Autism is medical. Call it what you want, but there are metabolic underpinnings for the behaviors that we see in complex kids. So you need to find a doctor who understands that and can help you figure it out. Dana says, we appreciate you and your team. Thank you so much. We love your family, Dana. So we have a few minutes. So if anybody has any other questions or anything you need me to clarify, I'm glad to do that. Make sure I'm not missing anything here. All right, good. So last couple of minutes, drop me any questions that you have. You see my email is there. You can email me anytime if you have questions. If you're interested in getting scheduled, I have Brittany Wade, who is the person who handles all of my new patient intake. So she is the one to get in touch with. Her email is brittany@covenantwellness.net. Oh, hi, Druval. Oh, thank you. Thanks for coming. So if you're interested in learning more, maybe scheduling an appointment, definitely reach out to Brittany and she can help you. Courtney says, amazing progress being made in our household. Isn't that the truth, Courtney? And in fact, I need to get you on a webinar or a podcast episode to talk about your kiddos and the things that we're seeing with them, because things are turning around pretty significantly in your household. And I love it. It makes me so happy. So other questions or comments before I let you guys get on with your day? All right. So there's always a replay available. So if you missed anything, you can definitely go back and look at that. You'll get that replay link in a day or so. Sorry for the technical glitch with the internet, but it looks like we got right back on track. So, all right. So don't forget, I do a webinar generally the first Friday of every month. In May, our topic is hypermobility, Ehlers-Danlos, hypermobility, POTS, just sort of that topic overall. So we'll be kind of diving into getting you familiar with that. So Lindsay says, we have tried functional medicine with my son and it's helped, but they don't do these tests. Is that something you do in the office visit? We live in St. Louis. So Lindsay, yes. We have a couple of options. So I generally, if it's possible, I prefer to see kids in person the first time. And based on the history and the exam, then I decide what tests to do. To be honest, that metabolomics urine test is so impactful. I do it on almost all kids as a kind of a first step. And so, yes, we would order whatever tests your child needed that particular day when you're here. We'd send you home with the kits. The urine and the stool tests are things that you just collect at home, and freeze and send off. And so if we needed to do a blood draw, we could do that. If coming to the office is absolutely not possible, we can manage this via telehealth distance-wise. So I can do your visit online, sort of like this, and then whatever tests you would need, I can order and have sent to your house. So we've got the whole distance thing figured out. So whatever works for you, we're happy to do that. So be sure to get in touch if you feel like we'd be a good fit. Be sure to reach out to Brittany, and I'm putting her email address here in the comments. So it's Brittany@covenantwellness.net. And we'd be happy to take your child for sure. Other questions? Any other questions? I hope everybody has a great weekend. Don't forget the May webinar. You'll be seeing it on social media. Again, we're talking about hypermobility syndrome, Ehlers-Danlos, and POTS in May. You'll also see every month we send a newsletter out. So generally we'll give dates for any kind of upcoming event as well. So so we try to keep you well informed and educated about all of these issues. So I have an empty nest now. This is my life's work. So I love getting the word out there and helping kids and their families because I was one of you. And I'll never forget how hard that was. So, all right, guys, have a great weekend. Thanks for attending. And we'll see you next month for our next webinar. Have a good day.